Alright, so we went to the clinic for the very first time. So around Pasadena, there's a lot of Spanish speakers around the area. So as I'm waiting for my patient, I'm like, okay, what is this patient gonna be like? We got a chart review of what to anticipate. So she came into the room and she was like, hola, and I was like, hola, oh no, oh no, oh no, she's Spanish speaking. So since there was a language barrier, the time to get everything done was gonna take twice as long. So I'm reading the chart review before I see her and something just doesn't seem right. The diagnoses was that she had osteoarthritis, but she was 36 years old and this pain started to come on 6 days ago. Already there, I was like, something doesn't seem right. So when I talk to her, I'm gonna have to weed out a lot. But because of this language barrier, I knew like, oh my gosh, this is another obstacle in itself. She comes in, we're talking. What's really cool about this hospital is that they have this translator. So they just have an iPad on a little stand, and then me and the patient and I are watching the iPad and we're video chatting a translator. So this process was great. It was a great experience, but it took a long time. So within the hour, I probably spent about 40 minutes in the subjective exam, meaning just talking to her. So this is what happened. She was complaining about elbow and wrist pain. She cleans for a day job and she has kids. And she complains of pain after she's done cleaning, which is an 8-hour shift, and it gets more aggravated when she plays with her kids. So she's telling me about all these pains about her elbow and wrist, and we're going through the whole eval, and I was like, okay, I think I might know what it is. So I'm thinking, I think it might be an overuse injury, so I'm gonna think about that. I kid you not, we're about 30 minutes in, 35 minutes in, and then the last thing she says is like, you know, I actually have some pain, I forgot to tell you, some pain up my neck, and then it kind of like makes it numb-ish. Like, I don't know, it goes down. So I'm thinking, okay, now that we have some next stuff, maybe it's like some cervical radic. So immediately I go into doing the cluster. I go Sperlings, I do distractions, test, and everything. She had less than 60 degrees on one side. And I was like, okay, cool, cervical radiculopathy. But it was actually interesting because, you know, there's this language barrier, and now you're talking about like messing with the head of somebody. It kind of puts them in a vulnerable position. So a lot of the treatment was just getting her to relax and me telling the translator when I have her in, when I'm holding her head. And I tell the translator, I say, okay, can you tell her to relax, please? Tell her, look, I have your head. It's very secure. You can relax. You're safe. I will take care of you. And then so as soon as the translator said it, she finally relaxed, so that was cool. So we treated her. She had some stiffness, especially on one side, so we did some up glides. What was actually interesting too was that her thoracic and cervical spine was just like, it was not the greatest. So it's like when I was trying to PA, it was like, okay, C2, C3. I was like, whoa, this is a big one. I was like, is this already C6, C7? Oh man, and it was kind of hard to kind of get in to feel the actual segments. So it was like, overall, it was kind of a dirty exam. You know, I was getting like positives here, but then I put the nerve on more slack, but then she said it was more painful. She was complaining of 10 out of 10 pain for a lot of things. Although it was dirty with this whole exam, the treatment was good. She went home happy, rapport was built. But overall, I think it was a great experience. I got to make a lot of mistakes. So I was like, okay, it's nerve. And then all of a sudden I'm doing lower quarter myotomes and dermatomes. And then later my partner's like, hey, you should probably check upper myotomes, dermatomes. And I was like, oh, right. Thanks, Kiana. But I'm really glad I got that experience. I got to experience the translator. I got to experience what a pro bono clinic is like. I got to put my hands on a real patient and get real reactions to different things. You know, just different strategies that you're gonna have to use to things that you don't even think about. Like, okay, like in class, everyone relaxes when you use the head, when you're trying to do stuff to the head because they know. But a patient, if you're grabbing their head, they're like, they get really, really like sensitive, and especially if they don't know you, they're not gonna just let you just trust you with their head all limp, right? So one of the battles that I had to face was to get to the patient to trust me using my words with the translator. Who knew? Maybe it'll help me later in the future. But yeah, that was my first clinical experience. I am so glad APU's program does this. This is probably the only time that we're gonna have a chance to be hands-on on a real patient in a clinic setting before we actually go on to our rotations. So this was a wise choice for APU. I really wish that they continue to do this because this is the first year that we're doing it. I really hope that these vlogs are very insightful for you. I do them just because I want to, and I want to give my experiences to other people so that they can learn. They can learn about APU's program. And honestly, I love doing it. It really would mean a lot to me. And I think it would be very beneficial for other students, like undergraduates, high school students. I just hope that my experience can be shared so that maybe it could help somebody else or give insight into what DPT school is like. Thank you guys. Have a good one.